is Dr. Thomas Klein. I'm coming to you from Raleigh, North Carolina. I'm a specialist in rare painful diseases, and I'm particularly concerned in the United States. There's been a bubble of ignorance and fear that's taking patients' medicines away from them without their permission. We've never done that before in the history of medicine in this country. This is a very unusual circumstance, and there are a lot of people involved. There's been 5 drug wars, starting with Eisenhower. None of them have worked. This is the first drug war where there's actually serious civilian casualties, unintended consequences. But they've been going on for 4 years, so it's no longer unintended. It's now purposeful. So there are some things that we keep getting asked about at the National Pain Council, and I just wanted to discuss several things. One is escalation. Escalation is a word used by opiophobes. It means, oh no, he needs more medicine. That means he's going to be addicted. Not true. If you read the FDA blurb on each opiate pain medicine, it tells you expect tolerance. In 70% of people who take opiates, there's going to have to be an upward adjustment. People who are opiophobic absolutely pass out when somebody says, oh no, you need more medicine because that sounds like you're a junkie. No, this is facts that you can get at the FDA. 2, you read in the paper that a doctor is rated, and by the way, when a doctor is rated, that means they're coming to ask for records. That doesn't mean they're arresting them. But it gets into the paper. They could do the same with a letter, but they don't. So you frequently read that a Dr. X had prescribed, and then they quickly say, over the past 4 years, 6 million pills. Well, pain medicine has to be given every 4 hours. If you're on a blood pressure medicine, you take 1 pill a day. If you're taking pain medicine, 6 a day. So the prescriptions are larger, right? This is kind of simple. Also, the DEA doesn't allow us to write for refills for controlled substances. So we have to write more prescriptions. So we write more prescriptions and we write for more pills. It takes about 4,000 pills a year for a person to be maintained with a rare painful disease. So when you read that there's been 1 million pills, divide that by 4,000, and you'll find out the number of patients in the practice, which is usually a couple of hundred, which is actually a small practice. So, a trick. Doctor prescribed 100,000 pills, and then they usually say over 3 years, so you gotta, figure out the math. But every time I've checked it, it's come to 100 to 200 patients, which is, a small practice. The Medicare, I want to just comment about it because I've been hearing some very, very nasty things. CMS, which is the new name for Medicare, our friendly Medicare administration, believes that if you give more than 200 MME a day, and that's what we would consider a small dose, then the doctor is sanctioned, and guess what? They stop paying the doctor. Just like that. They don't send the doctor any more checks for your visits. And then, if they really want to get nasty, they put the doctor on a special list. And now, if you go to the pharmacy says, oh, Medicare is not paying for your medications. Now that's dirty pool, as we used to say in the pool halls. That is horrible. Medicare administration is punishing patients because they don't like how much medicine the doctors are prescribing. And remember, we've said many, many times, low-dose medicine can cause as many problems as high-dose medicine, according to the FDA. Now, the FDA is the boss. The FDA is the agency that regulates prescription drugs, including opiates. So if they've said that low doses are as much of a problem as high doses, why are doctors giving patients 2 pills a day? This is a 4-hour drug. So here's what people are doing. They only get 3 or 4 a day or 2 a day, so they save them up. They're in agony. They save them up because tomorrow they want to go out and work in their garden. So they save them up and they take the proper number the day they're going out to work in their garden. That's really terrible. If doctors were dragged before a court and asked, why are you doing this? The doctor has no defense because the CDC was voluntary, it's an unauthorized, and if you read it carefully, the 90 milligram cutoff isn't really a cutoff. They misinterpreted it. Well, doctor, you misinterpreted it, so what, you're innocent because you misinterpreted it? No. You're a doctor, right? Advanced degree. Why didn't you read it? And what it says is, if you're contemplating going over 90 milligram a day, which is about enough for a large dog, justify going over it. So all you got to do, the doctor writes in the chart, I've justified it because blah, blah. And then there's no more limit. You can go to 1,000 milligrams if you want. Now, a lot of people say that if you go to 1,000 milligrams, you're going to get side effects. No, you're not. Not according to the FDA. If the FDA believed you were going to have side effects going to 1,000 milligrams, they would have a limit. And they do not have a limit. So we are in a bubble of ignorance because of the fear of addiction phobia, and it's harming several million people, including people that have taken their own lives because that was the answer for them to control pain after their pain medicines were taken away at the urging of the government. Thank you, and good evening.